provide emotional support by supporting the client's choices concerning terminal care. Directives help maintain the client's personal dignity and localizes control. Emotional support on the bottom of page 843. Emotional support is always part of nursing care. So remember, you need to know the difference between sympathy and empathy, right? They're different. Make sure you know them when you're dealing with a dying patient. Should nurses stand at the bedside and cry when somebody's dying? No, absolutely not. But it is okay to go over and lay your hand on a family member and say, I'm going to give you time, I'm going to step out, you do as you choose. But we should not be standing at the bedside crying. We should remove ourselves from that atmosphere before it gets to that point. Nor should you be attached to that patient like that either. Now, we do have hospice. Those people are long-term. They're usually 6 months of dying. So you can become attached to the patient, but you have to keep your emotions in check also, because you're the one in control of the situation, and you're going to have family members come in that, they lose control. When people die, they lose control and they really flip out sometimes. So it's our job to keep those people calm and to make sure nothing else happens while we're in that vicinity too. Because if you got somebody that passes out while you're tending to, you're going to have to stop and care for that person along the way too. We just can't step over them and keep moving. So you have to control the whole environment around you. If you look at Nursing Guidelines 38-1 on the top of page 844, helping dying clients cope, accept the client's behavior no matter what it is. Like I said, they're going to be mad, they're going to be angry, they're going to blame you for a lot of things. Not your fault, but it's not okay to stand and talk back to them. Just shake your head, yes ma'am, yes sir, and move on. Is there anything else I can get you? We don't need to talk nasty to those people, even though they might be talking nasty to us. Providing opportunity for the clients to express feelings freely. Try to understand the client's feelings. Even though we might not, we need to try to understand how they feel. Use statements with broad openings, such as, it must be difficult for you. Do you want to talk about it? Getting them to talk about how they feel could also make them progress into another stage of dying. They might go from bargaining to depressed or depressed to acceptance by us talking to them and letting them know what's going to happen. We also need to tell our patients, or talk to the family members. There is when people are dying, they hear people outside of them. When my grandma was dying, I told her, it's okay, Grandma, you can die. We're all here together. It's okay for you to go. She did. She died peacefully, and I did not believe that up until that point that happened to me in my life. But it works. If you tell that loved one it's okay and we all accept you dying, they will die and they will go on and move on. Because people die and think, I can't leave my children, I can't leave my grandchildren. Financially, I've left them in a bind. They worry, which can also prolong dying too. Let's see here. Dying with dignity on page 844 means the process by which the nurse cares for dying clients with respect, no matter what their emotional, physical, or cognitive state is. So just because you think somebody can't hear you or they slipped into the coma state before they die, they can still hear you. Hearing is the last thing to go. So don't go in there being disrespectful. Don't go in there talking about coworkers. Don't go in there talking about what happened on the floor. You still greet those people as you would anybody else. Hi, my name's April. I'm going to be your nurse for the day. Even though you think they don't hear you or they're not with you, they are. Just because they don't open their eyes and respond back to you doesn't mean they can't hear you. Okay? So be professional. Arrangements for care. In general, clients have 4 choices: home care, hospice care, residential care, and acute care. These are the 4 stages that they can go to die. Respite care. This is relief for the caregiver by a surrogate. So respite care, my example for respite care is the Home of the Innocents. Those moms of those special needs children, they never get a break. Even when they're 20 years old, they still have to provide care as if they're a new baby. So Home of the Innocent is a respite care. You can take your kid down there and drop them off and leave them for 14 days and come back and get them. And there's nothing said to the parents. There's nothing. They just say, hey, you need to be back on this day to pick your kid up. Now, there's a bill that comes with it, but there's an alternative if you need a break, if you're up to your wits' end with taking care of this kid, because it does get trying after a while, 24 hours a day, 7 days a week. It's like raising a baby. your whole lifetime. So that's an example of respite care.
They do that with the elderly too, don't they?
Yes.
Like have-
Hospice does that too.
But hospice, you have to be dying though.
Yeah. Well,
With respite care, you don't necessarily have to be dying, it's just like a babysitter, somebody's coming in and taking over to give you relief
Like home.
until you're ready to come back.
we used to have patients that are not dying, they just have Alzheimer's, but they just didn't have I guess the caregivers are really tired and they'll do like 5 days maximum.
Correct, so it's like babysitting, we're gonna give you a break,
Right.
let you go, get your rest back up, and then come back, you can come back and get them
Yeah.
and take them back home with you. Yes.